Hello, welcome. I am Cassandra Cassidy. I'm a DNP in nursing, and I am a registered nurse as well. I'd like to talk with you today about 5-year planning. Whether is it even relevant? Historically, in the nursing profession, it's been recommended that we have a plan to help propel us in our professional growth within the profession. And so I propose to you that it is. It's as relevant, if not more so, today than it has ever been in the past. And then why would it be so now? Is primarily because we have increasing staffing shortages, and it is so easy for us to get caught up in trying to survive the shift, trying to complete a schedule, trying to just maintain a routine, that it takes our energy, and we're in and could just honestly be in survival mode, which doesn't really allow us the fulfillment that we had hoped for. It certainly doesn't optimize the potential for us to provide to the profession itself, and ultimately may leave us to feel less rewarded and have a shorter duration um, within the profession itself. So ultimately, having a 5-year plan in place gives us a sense of direction and a focus to help us steer our nursing endeavors or experiences um, towards where we feel that we would be most rewarded. And maybe that is being as a nurse, maybe it means financially, maybe it means whatever it might mean to us, in that capacity, giving us the control, having more control of what we get and can provide to within the profession itself. So yes, having a personal 5-year plan is very relevant today. And so what is that? So I really wanted to dive in and just talk a little bit about that. So if you're interested, hang out. I have resourced this book here specifically to start with because I wanted to say, what is planning? Planning is defined as deciding in advance what to do, who is to do it, and how, when, and where it is to be done. Therefore, all planning involves choosing among alternatives, right? In nursing, we have so many different types of options. That's what I love about nursing there, with 1 degree, at least in our broad spectrum, like a registered nurse status. We have so many options with that same credential that we can dive into. And so we certainly need to choose what we are most readily acclimated towards and excel within. So when we think about planning, we're really looking at short and long-term goals. Okay. And this requires us to envision, where do we want to be? Soul search. What am I feeling fulfilled doing? How do I see myself, envision myself working as a nurse? Because again, we have lots of alternatives. So where would I feel the most benefit for me and my family? Maybe it's scheduling focused, maybe it's financially focused, maybe it's what I can give back focused, maybe it's all of that. And so searching through alternatives is really important for me to envision what I'd like to do and what is the criteria for me to get there, and start incrementally planning that like a ladder, one step at a time, right? It's a 5-year plan. So we're looking at short and long term. In that stair stepping to get to where in that 5-year mark, I have incremental goals, right? A goal may be defined as a desired result towards which is directed, right? So it's goal. It is much like philosophies and values. It changes with time and requires periodic evaluation and prioritization. So Today, if I set a 5-year goal, I need to periodically evaluate that 5-year goal because I might get 1 year into something and I'm moving right along into one out of 5 years. I need to reevaluate. Is this still what I thought it would be? Do I still have the ambition to go that same direction? Or maybe I've learned that I have other assets that is serving me well, or maybe other opportunities have surfaced that I didn't even realize was an alternative for me. So I really need to reevaluate periodically to make sure that I'm still serving myself well and propelling within the profession itself. And I need to do that incrementally and then modify my plan accordingly. When I build my plan, it needs to be specific, simple, and realistic. Okay. All the way through my planning, and that includes my goals, simple, specific, and realistic. So incrementally, I need to evaluate, and my goals need to be very clear so that I know whether or not I've achieved it. And then have those again built-in evaluation checkpoints. Very, very important. And you think, okay, well, sure, I have a 5-year plan and I have incremental goals to help me reach that. So maybe part of my 5-year plan is I'm just finishing up nursing school. And so part of my 5-year plan is that I pass the NCLEX and then I serve work 2 years in an ICU unit because I have looked far out and I know I need to work 2 years in an ICU, a specific type possibly, because what I want to do is go back to school. And in order for me to get into the program that I want to, I need 2 years of ICU experience. Maybe it has to be a level 1 trauma. And so I want to make sure that I get that in the first job that I get, getting those 2 years experience. And maybe I also need to have a specific credential in place to help me apply to the next academic journey that I'm going to be taking. Right? Maybe my 2-year goal is getting experience in a specific area. I'm getting the type of schedule that works best for me and my family. Maybe it's finding the job with the ideal schedule in the ideal location so that I can enjoy more broadly speaking other personal aspects. And then therefore this profession would be serving me really well because I'd have that work-life balance that's really important to me. Maybe it could be anything because we're all unique and we have so many different alternatives, but one step at a time in order for me to get there. And if I have a plan in place, then I'm more readily going to be able to keep myself in the direction that would serve me well. Because here's the thing, the time will pass. The time will pass whether I am steering my professional activities or agenda towards a direction that I want to go or not. The time will still pass. And so if I can envision where I want to go, I can plan even small baby steps along the way, little goals that help me build and help me step towards that vision. That's part of my 5-year plan. Okay. Here's something else that I wanted to share. And this comes from Nodder. Here's a quote: "Shooting for a better future is terrific, but if short-term wins don't demonstrate that you're on the right path, you will rarely get the chance to fully implement your vision." Again, that speaks to me, referencing the importance of reevaluation. What if I thought I would really enjoy something specific and then I get, 12, 18 months into it and it's nothing like I thought it would be? Again, that's part of that reevaluation process. If I'm not getting the confirmations along the way that I am going the direction that I need to go, there's no need in me spending 5 years or more doing something when I'm not going to be feeling fulfilled as if I might if I was endeavoring in something that gave me the sense of fulfillment. And it also might end up shortening my professional career in general if I'm really just miserable. So we must reevaluate, okay, as we learn more, as we grow, as we grow our professional knowledges, our experiences, and our understandings of how things work within the profession itself. So as we do that, as we grow and we continue, here's one more something that I wanted to share with us. Such knowledge, we have such good resources, and we're forever learning. And so I've certainly, here's one more thing: Quantum Leadership. This book right here, really good book. Enjoyed it. But here's a quote out of it: "Chaos challenges us to simultaneously let go and to take on. It reminds us that life is a journey of constant creation." And that is so true. And our 5-year plan helps us to towards a direction. It helps to prevent us from just surviving, but taking control of our profession, our contributions within it. And so having a plan, 5-year plan, having goals within it helps to keep us moving towards a direction, and achieving where we might fall stagnant otherwise. Right? And so that's um, really an important aspect and empowering. And it might be scary and chaos, but change really is something that in our profession is something that is a necessity for us. We must continue to grow. We must continue to grow our knowledge, our understandings, because where we work is constantly evolving. How we serve as a nurse within our capacities is evolving. What we use to nurse with is evolving. Our knowledge, our research, everything is growing, and we must stay competent within it. And so, as we grow within those environments, we need to reevaluate where we are, how we're serving, what we want to do, and new opportunities that are coming along. So, I hope that this helps you to have a better understanding of what a 5-year plan is. But more importantly, I hope this conversation with you helps you to create one for yourself if you do not currently have one in place. I hope it serves as a means to empower you or challenges you to think, empowering you to grow your own 5-year plan. All right. See you next time.